journalist with the Irish Times and the Guardian, whose speciality is around agriculture and food. She is going to be taking over from me and guiding us through and introducing the panelists. And you know, if you do Google Ella, and she's not asking you to, it will say that at the age of 17, she was told that she should give up her ambition of being a farmer because she wasn't a man. Well, boy, she's proven everybody wrong. She is now a leading expert on this. So it just shows you should never listen to what people tell you. Warm welcome to all of our panelists. I just had a chat with them. We're really honored to have everybody here. And I do want to say a special recognition to Dr. Mike Ryan. He's a colleague on the interagency, but I guess the last time I saw Mike in person was, you know, tragically at the funeral for Dr. Peter Salama, his colleague. And it was probably just 2 or 3 days before Geneva went into lockdown. So it doesn't seem that long ago. We are going to hear from the Minister of Overseas Aid, Colin Brophy. And I really think it's important, we want to take this opportunity to recognise the Irish government's long-standing leadership in the fight against hunger. And Ireland now, with its seat in the UN Security Council, at the time when millions of lives are hanging in the balance, and we know that Ireland will remain committed and determined advocate on behalf of those. But I guess before I hand over to Ella, I guess the scale of this challenge, you know, we talk about a lot of data and numbers, but at the end of the day, what we know is for every statistic, there is a woman who is struggling to feed her child and failing. And that is unacceptable. And on this World Food Day, you know, if you go back, and we can go way back to the World Food Congress, this is the US elections are on. If you go back to the 35th President, John F. Kennedy, he said then, we have the ability as members of the human race, we have the means, we have the capacity to eliminate hunger from the face of the earth in our lifetime. We need only the will. That was 57 years ago. We're better connected. We have more resources. We understand the problem. It is preventable. We now need to get the political will. Over to you, Ella. Thanks very much.
Dominic, thanks so much. And hello, everyone. You're very, very welcome to the Global Hunger Index 2020 online launch, hosted jointly by Concern here in Dublin in Ireland and also Welthungerhilfe in Germany. And I'm really, really pleased to be part of this and to welcome all of you, a very wide and diverse audience from around the world. And, you know, for the next hour and a half, I think we're going to have some really stimulating and interesting conversation. We know the problems, but also the kind of inspiring solutions to those problems as well. So this year's Global Hunger Index presents us all, I think it is more than fair to say, with some very stark facts about the state of world hunger. Although it has gradually declined since 2000, we have more than 50 countries have a hunger situation that's either serious or alarming. Almost 690 million people suffering chronic hunger, 130 million people experiencing crisis levels or worse of acute food insecurity. And all this data was gathered pre-COVID, so more recent projections are more stark. And last month, indeed, the head of the World Food Programme said that the world was on a verge of a hunger pandemic. A wave of hunger and famine still threatens to sweep across the globe, he said. So the scale of the challenge is enormous. We know what the problem is. We have just 10 years to achieve the zero hunger within the Sustainable Development Goals. So we need rapid and effective action. And that is what the next hour and a half is all about. So we have a fantastic expert panel looking at global health from a variety of perspectives. We know from the evidence that our food systems are both unfair and inadequate. So I suppose, how quickly can an integrated approach to health and food deliver zero hunger? COVID has shown us that we are all, of course, interconnected, humans, animals, plants. We all have this shared environment. So we will also discuss the value of One Health approach to end hunger and the practical coping mechanisms of the extreme poor whose lives have been so severely disrupted by the pandemic. So we will have a panel discussion on this with, as I said, a fantastic group of people, Dr. Robin Alders, Hasina Rahman, Veronica Korogo, and Dr. Sinead Walsh. We've received an awful lot of questions for our panelists, and we will put those questions to them later. We're not using the chat function or the Q&A function, so I hope you can all just relax and watch this discussion. We are recording the event, and you can watch back or you can share it with your colleagues. It will be on the Concerns YouTube channel. But first, I'm going to play now a word from Ireland's Minister for Overseas Development, Aid and Diaspora, Colin Brophy, who unfortunately could not be with us, but he has taken the opportunity to brief us on Ireland's commitment to addressing global hunger.
Hello and welcome to the 2020 launch of the Global Hunger Index. I'm delighted to welcome you to this important event which coincides with World Food Day. I want to thank Concern Worldwide for their work in producing this publication and for hosting this launch event in partnership with Welthungerhilfe. Framing our discussion today is the SDG goal of achieving zero hunger by 2030. Ireland has been a long-standing champion of global efforts to reduce hunger and malnutrition, born out of our historical memory of the Great Hunger. The Global Hunger Index makes an important contribution to our understanding of the challenge ahead if we are to meet this goal. For me, the most critical and stark takeaway from this year's index is this: the experience of living without adequate access to sufficient nutritious food is all too common. Although hunger worldwide has gradually declined since 2000, progress is far too slow and hunger remains severe. Let us be clear, this means children going to bed hungry at night. This means people die before they should. This means that children are not enabled to learn to their full potential. Before the onset of COVID-19 this year, 135 million people in 55 countries were facing acute hunger. With COVID-19, 270 million people are now short of food, with an overlapping crisis which will likely increase nutrition insecurity for millions more. This year's millions of people in the Horn of Africa faced COVID-19 pandemic and the resulting economic downturn, while at the same time enduring the worst outbreak of locusts in 25 years. This came on top of existing hunger caused by climate and long-standing conflict. It's now clear that COVID-19 pandemic threatens years of progress in the fight against hunger. No region of the world is immune, as this year's index makes abundantly clear. Combating global hunger and malnutrition is a core part of Ireland's international development policy. A better world, which is underpinned by the UN Sustainable Development Goals, our focus is on reaching the furthest behind. At today's event, we ask ourselves the critical question: given the far-reaching impacts of COVID-19, how can we find opportunity within this unprecedented crisis to build back better, accelerate our efforts towards meeting the SDGs, and reach the furthest behind first? Ireland recognises that agriculture and food systems are central to reaching the global goals and to safeguarding a shared sustainable future for all. We also recognise that food systems must properly nourish, provide energy, damage neither health nor the environment, and support equitable access to resources. And we are scaling up our efforts in response to that challenge. The Department of Foreign Affairs, in partnership with the Department of Agriculture, Food and the Marine, is working towards adopting a sustainable food systems approach. This will inform Ireland's development activities within the food systems sphere, covering agriculture and rural development, nutrition, gender equality, climate action, and the private sector engagement. It will also encourage greater coordination among the various stakeholders, state agencies, NGOs, private sector, and researchers. By taking an integrated approach to health, food and nutrition security, it is possible to achieve zero hunger by 2030, a message echoed in this year's Global Hunger Index. Next year, the UN will convene a landmark food systems summit, bringing together governments, development agencies, the private sector and research bodies to recommit attention to the developing well-functioning food systems that contribute to the achievement of the SDGs and building back better after COVID-19. Ireland was among the first to call for a high-level event to champion a food systems approach. This is why I am pleased to announce today that Ireland will contribute €1 million to the newly established trust fund for the Food Systems Summit, hosted by our partners, World Food Programme. And I'd like to take this opportunity to warmly congratulate the World Food Programme on being awarded the Nobel Peace Prize. It is well deserved. Ireland's support will enable critical country-level dialogues in least developed countries, fragile countries and small island developing states, held in advance of the summit. Ireland's contribution will help to ensure that the summit process is meaningful in these countries. It will empower key voices, championing food security and sustainable food systems, and target investment to where it is most needed. I wish you well in today's discussions and will end by echoing the urgency in this year's index. With only 10 years remaining until 2030, when the promise of zero hunger is due to be fulfilled, it is more critical than ever to make good the SDG commitment to realise the right to adequate and nutritious food for all. Thank you.
Minister Colm Brophy there reiterating the commitment of the Irish government and their focus on combating global hunger. Now it's my real pleasure to introduce and hand over now to Dr. Mike Ryan of the WHO, who's been at the forefront of managing risks to global health for nearly 25 years. He is, of course, the Executive Director of the WHO's Health Emergencies Programme. We're very grateful for his time this afternoon. He joins us from Geneva. Mike.
And it's a great pleasure to be here, ladies and gentlemen. And allow me to start by first thanking Welt Hungerhilfe and Concern Worldwide for the opportunity to speak to you at this very important event. As it takes place on World Food Day, and exactly 1 week after our colleagues in the World Food Programme were awarded the Nobel Peace Prize for its courageous and far-ranging work in fighting hunger and malnutrition everywhere. I've worked so many times with WFP in the field. They not only feed the world, but they move the UN system and they facilitate the success of so many other UN agencies and NGOs around the world. I always say that WFP rocks, and they deserve this award above any others. The topic of today's event, 1 decade to zero hunger, linking health and sustainable food systems, it's close to my heart by itself, but today is also important to me for a personal reason. I'd just like to show you a short video clip if you have it there.
Then it's time to go into the feeding centre. Peter is one of Concern's senior doctors.
If the young adults die quickly, then the children and their family are also extremely vulnerable to dying shortly after, especially if their mothers have died. So that's why we've chosen to target adolescents and adults more in this program. His appetite's returning and he's a bit stronger now. He couldn't sit up when he came in, and now he's able to sit up for short periods of time, and he's asking for food, which is always a really good sign. Okay.
Thank you, Ella. Dr. Pete Salama, as Dominic mentioned before, was Dominic's friend and a friend of colleague to so many of us in the wider development and humanitarian community. He dedicated his lifetime to serving the most vulnerable. He worked with us at WHO as Deputy Director General in the Emergencies Programme and head of the Universal Health Coverage Life Course Programme. His own public health and humanitarian journey includes his CDC, MSF, UNICEF and WHO. And he had one of the most impressive and impactful careers I have ever known. And his work is still touching countless lives until this day. But Concern Worldwide was the first love, in a sense, of Pete's life, and an organisation to which he had tremendous loyalty. I'm from Ireland, and I value Concern. Pete was from Australia, and came to see Concern as a central piece of his life, and it was one of his most cherished roots. That was Pete working for Concern 20 years ago in a feeding centre in Sudan. And to me, Pete embodied everything that I'd like to speak to you about today. The connection between food and health, food and peace, between health and peace, between life-saving interventions in the field and global political advocacy and activism, and how these two things need to come together now on this planet if we're to solve a decades-old problem of having the means to do something but never having the will. Pete's last country mission was to Somalia in January this year. He travelled there with our Regional Emergencies Director and the head of our fragile and conflict-affected states to explore how best we could use primary healthcare strategies in fragile contexts and develop capacities both to fight and combat malnutrition. The last time I ever spoke to him was from the runway in Mogadishu Airport, where he was basically calling me in Geneva to say how much more we could do, and when he got back we needed to get this together and do better in Somalia, and in that sense, the report that you are launching today is fundamentally linked to that Sustainable Development Goal of ending hunger and achieving food security, but also for us in WHO, that goal is linked to the central goal for us, which is ensuring healthy lives, SDG 3. Food and nutrition are a driver of health. Good nutrition makes for strong bodies, healthy minds. Malnourishment and hunger drives chronic illness and death. Food and health are intertwined. WHO works very closely on the issue of food security, malnutrition and health with member states, with key UN organisations and NGO partners. We've worked on multi-system framework for action that governments and partners can use for the prevention and detection and treatment of child wasting, guidance on the management of child wasting, on developing and implementing an integrated famine risk reduction programming between the different agencies at field level. So much of this ongoing as we speak. But as your event outline is asking, given the impact of COVID-19, what will it take to stop the erosion of progress? How can we build back better? And how can a One Health approach strengthen collective efforts towards zero hunger? There are big questions. So before speaking about the impact of the pandemic, let me start by outlining the pre-COVID-19 situation. Put quite simply, right up to the beginning of this pandemic, more and more people were going hungry. We were going backwards. According to the latest food security and nutrition in the world estimates, and you said it, the 690 million people went hungry in 2019. That's up 10 million from the year before and up 60 million from 5 years previously. We were going backwards anyway. We were sliding backwards. Over the past 5 years, tens of millions of people have joined the ranks of chronically undernourished. And many countries struggle with multiple forms of malnutrition, not just the hunger we see in camps, but malnutrition, bad nutrition, not just hunger. High costs and low affordability also mean billions cannot eat healthily or nutritiously. The hungry are the most numerous in Asia, but it's expanding fastest in Africa. The global burden of disease estimates in 2019 indicated that 1 in 5 deaths on this planet is associated with poor diet, the absence of food, the lack of food, or poorly nutritious food. COVID-19 has not only decelerated all progress towards SDG 2 and SDG 3, and it risks undoing progress in both. It has laid bare and amplified systematic inequities and vulnerabilities that go far beyond health. The COVID pandemic is, in effect, a relentless reliever of the inequities that already exist, and an amplifier of those that are there. We're still in the process of evaluating the full impact of this ongoing global pandemic on our socioeconomic system. But as you said, there are various estimates of up to another 80 million people and possibly up to 130 million people going hungry in 2020. And those numbers keep varying. You know why? Because they keep going up. Every time we look at it, that number goes up. Because this thing isn't over, it is developing and evolving, it's accelerating, and as it accelerates and as it impacts our social and economic systems, the knock-on effects of that on hunger are huge. The effects are likely to be the highest in low-income countries and middle-income countries, and especially in countries with conflict and those with the highest poverty levels and the largest vulnerable populations. Food workers have been affected and food safety is also challenged. We expect a 14% increase in children suffering from malnutrition around the world. That translates into over 6 million children, extra 6 million children who are malnourished. Not only has it worsened the food situation, but it has revealed, in a sense, the extent of the ongoing hunger emergency. The pandemic has also caused severe disruptions to essential health services for immunization, maternal and child nutrition services, non-communicable diseases, family planning, and more. These are a series of converging risks. This is not just about hunger. It's the hungry child that is not vaccinated. It's the hungry child that is not able to access treatment for malaria. It is the hungry child whose water has got dirtier and who has no access to sanitation. We are creating the conditions for a catastrophe, and we need to take action. The pandemic has highlighted and exploited the inequalities within and between countries and has served as a profound revealer of the inequities on this planet. It is revealed and it is revealing that we have built fragile food systems that put healthy diets out of reach of millions, and that we have created essential health services which many communities cannot access or afford. This fundamental stress test has highlighted the consequences of a lack of focused investment in essential public health functions and capacities for health emergency and disaster risk management. It has exposed the weaknesses in service delivery to quickly scale up COVID-19 treatments while maintaining essential services, and this is also true in high-income countries. Lack of access to health services, now exacerbated by this epidemic and pandemic, has left billions of people, including many in rich countries, without reliable and affordable access to essential health services. Furthermore, massive inequalities have led to the deaths and loss of livelihoods, been strongly driven by socioeconomic status, by ethnicity, and by underlying conditions. The secondary disaster and the greatest challenge we are facing during this health crisis is to maintain essential services in fragile states. We cannot overlook the interface of this pandemic with other risks that often occur in the most vulnerable countries: conflict, natural disasters, and other communicable and non-communicable diseases, and lack of access to essential health services and a stable food chain. It is imperative that we create a momentum around the idea that aid should not suffer, regardless of all the other challenges we face together in the world. Food deprivation has historically been instrumentalized as a weapon of war, but often access to food and essential health services have proven to be the stabilizing pillar for communities in conflict settings, a bridge and a prerequisite for peace. This is why access to nutrition, safe and affordable diets needs to be safeguarded and promoted as a cornerstone to the response of COVID-19. This will require investment in strengthening production and distribution of food that supports healthy diets. Existing childhood feeding programs need to be re-established and scaled up. In anticipation of the increased incidence of global acute malnutrition, we will need to invest in prevention, early intervention programs, and primary health care that can absorb the shock and address the issues at community level. On the 1st of April, as the Minister said, the General Assembly proclaimed the United Nations Decade of Action on Nutrition, and the UN Secretary General has agreed to convene a food systems summit in 2021 to raise global awareness and land global commitments and bold new actions that transform food systems to resolve not only hunger, but to reduce diet-related disease and environmental issues. We will work closely with the UN agencies and other stakeholders on preparation of the ground. This year's Global Hunger Index report clearly shows the influence of public health, animal health, and environmental and ecosystem health resilience on the capacity to reach to react to global acute or systemic crisis. A One Health approach will naturally be at the center of future solutions to tackle hunger and food production deficiencies. Our environment, our food systems are inextricably related to health. Globalization, by some measures, has brought benefits, but it has also created converging risks. We need coherent responses to those risks. While the series of events that led to the emergence of COVID-19 are still unknown, it is most likely a zoonotic origin illustrates that our poorly regulated and unsustainable interactions with and the use of wildlife for food can have devastating public health and socioeconomic impacts. There are also opportunities to exploit our new connectedness for good, for justice, and for equality. What may be driven initially by food security and livelihood imperatives quickly highlights why we cannot ignore hunger and food insecurity, and why we have to take a One Health approach to address public health risks of zoonotic origin. It is estimated that animals, particularly wild animals, are the source of more than 70% of all emerging infectious diseases in humans, many of which are caused by novel viruses. We work very closely with our colleagues in FAO and OIE, and we are committed to promote a One Health approach to managing those public health risks at the animal-human environmental interface. Finally, in closing, I'd just like to say that equitable access will be the key element that would allow us to come out of this whole pandemic stronger. Equitable access to nourishing food is and will be equally important as equitable access to vaccines, equitable access to healthcare. the availability of safe and nourishing food, or the absence of it, is the single biggest cause of global ill health. The COVID-19 pandemic is only a global health crisis. Not only a global health crisis, but it is also a global food crisis. Both expose the same injustices, the same denial, the same fragilities in society, the same prejudices, exclusion and stigmatization, the same weaknesses of governance, and the same inequities of access. Food, health, and equity are inextricably linked. They are not the bonus for development, but the prerequisite for stability, the prerequisite for development, a prerequisite for peace, and a prerequisite for justice. We simply have to learn. We must pivot towards sustainable growth, sustainable development, sustainable health systems, sustainable food systems, a sustainable planet for everyone. If we do not, the hard-won gains we have made in recent years are at risk. The crisis can bring out the best and the worst in us. We can choose a different future. The future is not written. Pete always believed that. The future is not written. He inspired me, and I know he inspired many of you. I miss him every single day of my life, and I hope that that his legacy will be what he dreamed of and spent his whole life working, speaking out, bearing witness, and serving those who have least. I dedicate these words to him, to Annalise, his partner and wife, who also work for Concern, and to his three sons, Luca, Kai, and Matthias. Thank you.
Dr. Ryan, thank you so much for that, and a very moving end as well to it. Am I correct, Dr. Ryan, in saying that you are able to stay with us for the next half hour?
Yep. Am I on?
Yeah, you're on there. You're able to...
Yeah, I'll be here as long as you see me, Ella.
Well, thank you very much. And I suppose just before I introduce the panelists, Dr. Ryan, I just wanted to put one question to you. I mean, you laid out so clearly, you talk about the means, but never the will, and we are creating the conditions for a catastrophe. We had a question in from our viewers. One of the key messages throughout this Global Hunger Index is the importance of engagement from high-income countries to address global hunger. How can we convince these countries and their governments that hunger is not a faraway issue with consequences affecting only poor countries?
That is the $100 billion question. Yes, and I think, first let me say that so many ordinary individuals and people in society contribute so much of their own incomes in aid and supporting great causes. And there's a huge humanity out there. Governments also, and the Irish government and the German governments as the two host governments of the agencies who are presenting here today or launching the report, are also showing great responsibility in their aid policies. But in the end, there's just not enough. There is just not enough investment in this, and we cannot continue to sustain this by just only making a humanitarian argument. It should be enough. Human suffering should be enough for us to do something about this, but obviously it's not enough. Dominic referred to the speeches of the great John F. Kennedy 57 years ago when he said, "We have the means, but we do not have the will." Nothing has changed. But we have to look at this also now as a global issue. What is driving migration? What is driving displacement? What is creating a lot of the instability in the world? The food or the lack of it, water or the lack of it, will be one of the greatest drivers of conflict in the next 100 years. So it is in the enlightened self-interest of the North to deal with this crisis, to get rid of this and create a more sustainable earth in which we all can live. And I would point to the developed world as well. There are hungry people in every country. This is not just a disease of the South and a result of poor development or corrupted development. Hunger is everywhere. Poor nutrition is everywhere. This is a global challenge, as is climate change, as is this pandemic. And the solutions to each may be slightly different, but they need to reflect the same approach, good governance, a commitment to getting this done, solidarity, international collaboration and commitment and the willingness to deliver on the promises we make. So the behaviors we need politically and the behaviors we need at the level of society are very similar. The things we will do, vaccination, feeding, and all of these, they're different elements. So I do think it's time, if we step back from this. And sometimes I honestly feel ashamed when I think of the planet we're handing over to our children. And we should be ashamed of ourselves in the way our environment is deteriorating and when our people are hungry. 1 in 10 people in this planet is hungry. I mean, just say it back to yourself, say it back to ourselves, reflect that, echo that in the room. It is entirely unacceptable because it's not necessary. So I do think that the political action is needed. I do believe we have the means to get it done. And I do hope that this is a turning point for us all. We all come together. We find a way to beat the pandemic, to try and beat hunger, and to beat climate change.
And just finally, briefly, Dr. Ryan, do you have a concern that as the economic impacts are felt by various countries around the world, that the instinct will be to retreat inwards as opposed to maintain international aid and maintain those connections and, as you say, maintain the obvious thing, which is this is a global issue?
Absolutely. And as I said, food is one of the greatest stabilizers in conflict. If we do not take feeding the hungry and fragile nations seriously and support the World Food Programme and others who are doing that job, conflict and instability will grow, and that will in itself amplify hunger, and it will amplify everything else. There is an imperative now to act because we have the means to do it. So I think that is for me the single most important thing. And the message is, normally when I go on and talk to international groups, I'm always advocating please support WHO, and we're very glad of that support. But I would appeal to you today, support those who feed the hungry, support WFP, support the NGOs who specialise in this area, because there's work to be done and they're ready to get it done. Please, please, please make sure we do not withdraw from humanitarian aid and development aid. It is central to stabilizing countries. It is central to the future stability of our civilization and our planet.
Thank you so much, Dr. Ryan. And as you say, we will hopefully, as long as we see you there, we'll hopefully bring you back in with some more questions as well. But we've got just under an hour now. I'm going to introduce our extraordinary panelists. We're very grateful to them for their time today. We have, first off, Professor Robin Alders, who is a senior consulting fellow with the Chatham House Global Health Programme. And for 30 years, she has worked closely with family farmers in sub-Saharan Africa. We also have Veronica Kirogo, Deputy Director of Nutrition and Dietetic Services in the Kenya Ministry of Health, and she's also a farmer herself. Hasina Rahman is the Assistant County Director for Concern Worldwide in Bangladesh, and she's led Concern's COVID response operations there. And Dr. Sinead Walsh, who is the EU Ambassador to South Sudan, previously the Ambassador of Ireland to Sierra Leone and Liberia, and she's also the co-author of the book Getting to Zero, which details her experience of the Ebola crisis. So I'm very pleased to introduce all of them, and I might start with you, Dr. Alders, Dr. Robin Alders. Could you please, I mean, Dr. Ryan has touched on it quite clearly there, but would you outline for us some of the sort of starkest realities that require us to adopt this One Health approach to fix particularly our food systems, which are so clearly broken?
Thanks so much. And firstly, thanks very much to the Global Hunger Index team, Chatham House and the Centre for Universal Health. The Global Health Program was really honoured to be invited to participate in this year's effort. When we talk about One Health, and there's been a focus on infectious disease, a focus on hunger, really, as has been presented, these are symptomatic of deeper drivers of a system that's just not working. So we have COVID-19. Many people are assuming it's coming because of interaction with wild animals that come into our food chain. We shouldn't forget that avian influenza came from our intensive animal industries. So there are multiple drivers that are causing these infectious disease problems. But at the same time, we have the locust plague in Africa. We have the spread of fall armyworm. We have African swine fever that's decimated 1/4 of the world's pig population. There are multiple problems, and we really need to work together. None of our sectors, the health sector, the agricultural sector, the environment sector, none of us have the investment that we need to do the job that we would like to do. We need to work together. We need to reinforce each other and to help both on prevention, on biosecurity, and on control measures. And there are, for those who are going to have time to come and read the essay that accompanies the Global Health Index, there are examples where these combined, these intersectoral approaches, interdisciplinary approaches are having a positive impact. And that's because in the lives of people, it's never one thing that's going wrong. And if you're able to find an approach that can tackle multiple issues, you're going to have a really symbiotic benefit as you go along.
Thank you. And I suppose, you know, looking in the next 10 years at this deadline for zero hunger with regard to the SDGs, what changes most urgently do you think are needed from a policy perspective?
From a policy perspective and from a societal perspective, I think one thing that would be really important, speaking also as a farmer myself, is the recognition that farmers and fishers are fundamental, and they should be recognized as the essential professions that they are. And part of the problem is that we have seen across the world declining numbers of people entering these professions because it hasn't had the profile that it deserves. The Declaration on Universal Health that was signed last year recognized the importance of food security. And really, there would be no work for doctors if farmers and fishers weren't already feeding people. It is fundamental. COVID-19 has shone a light on that. And so as we look in next year, we have two really important events coming up. The Food Summit being organized by the United Nations has been mentioned already. We have the Nutrition for Growth program as well that seeks to bring together health and agriculture and resilience. So these are very important events. But right now, as we respond to COVID-19, none of us know when this particular pandemic is going to recede, but we do know that in addition to health, it is impacting not only on people to go and harvest, but in getting ready for the next planting season, for maintaining food production systems. And it really is very important that for social protection programs, people think not only about delivering food, but working with local food producers and suppliers to bring them into social protection programs. So once again, you're getting multiple benefits from that investment. Going forward, ensuring that regions, regional economic communities, and farmers and fishers are involved in these discussions about what a new and transformed food system that's going to look like, that is equitable, where farm gate prices allow for farming families, farming and fishers to look after their own family and to care for their resources in the way that they would like to do. Another really crucial area that we haven't quite touched on yet is education. Our education system for our young learners who are coming through and for our adult learners. It needs to be tailored to the conditions where people live so that they understand how they can put together a nutritious, affordable diet using food that's available in their areas, and that farmers and fishers are having access to information and to knowledge to help them to farm, to fish sustainably, in tune with nature, and really using systems. I'm speaking to you from Australia, where we have lost 50% of our soil carbon since colonization. We need to farm differently as well. As was managed, this is not just an issue for low and middle income countries. High income countries, we have our own problems and we should share them honestly, because it's not just low and middle income countries that need to make changes. Here in Australia, we need to put carbon back into our soil. We have to farm differently.
Thank you. And Veronica Kirogo, I'm going to bring you in now in relation to Kenya. I mean, Kenya has made significant progress in tackling hunger over the past 2 decades. And I wonder, what lessons can we all learn from how you achieved that?
Thank you very much and for having me in this panel. And for Kenya, for the attendants who don't know where Kenya is in Africa. We are a low middle income country with a population of only 20% of our land is arable. But despite all that, in the last 2 decades, Kenya made significant improvement in the nutrition indicators as depicted by nutrition status of children under 5 years, because we were able to improve the levels of stunting from 35% in 2008 to 26% in 2014. How did we do this? One of the things is the multi-sectoral collaboration, because as Dr. Ryan had said, malnutrition cannot be tackled using one approach. You need food system to work so that you're able to tackle nutrition. You need education. And for us, we have one framework that addresses malnutrition, the Kenya Nutrition Action Plan. This is a strategic document, 5-year, 2018 to 2022, has been developed by a number of sectors: education, social protection, devolution and ASAL. We also have health, agriculture, and county government, because Kenya is a devolved government. And each of the sector understand the role they need to play in order to influence nutrition impact. Last year, when we did cost of hunger in Africa and for Kenya, we found that we are losing annually about 373 billion Kenya shillings. That's an equivalent of $3.4 billion US, or 6.9% of our gross domestic product. And all the sectors have now united in order to address malnutrition in a sustainable way. For instance, agriculture, who has a key resort area in the Nutrition Action Plan, are mandated in terms of improving food access. So recently they launched what we call 1 million kitchen garden initiative in order to improve the micronutrient access to many households, especially the vulnerable and poor resource household. We also have education in the school meal program, where we are also giving children, especially where they come from the arid and semi-arid area, they are given school meal. And most of the time, that's the only meal that they will be able to eat, because at the household level, food insecurity is quite key. But of course, we have a number of policy. In terms of policy environment, I can say that's also what has also made us achieve that. We have the National Food and Nutrition Security Policy, and also we have the health policy, we have the social security policy, where nutrition has been integrated. Of course, going on is how then do we sustain that gain? With the COVID coming in, we also have issues like drought and floods, and of course, low-cost invasion. So we are united in one, because we know for food systems to work, then we need to invest in agriculture, in education, in water, and that's what we are purposing to do in order to continue improving the nutrition indicators in Kenya.
Thank you so much. And Dr. Ryan, if I could just bring you in very briefly on the back of Veronica Kirogo's explanation there in terms of the Kenyan Nutrition Action Plan. And it seems that from what has been said so far, this idea of devolution of power to local people, integrated policies, and greater power for primary producers such as fishers and farmers is a key step towards this goal.
Yes, and I mean, I couldn't agree more. And I think a lot of this comes, you know, how do you match your sort of national strategy and the kind of long-term investment in the sector with local bottom-up action? And it's bringing those two things together, in facilitating and empowering communities. It's not about transferring the responsibilities of communities. It's about empowering communities to take control of their own future and their own lives and their own data, and give them the tools to be able to manage food as a resource, food as a source of income, food as a source of prosperity. And I think, and it's the same in health. You know, let's look at the COVID-19 pandemic. In many developing countries have handled this pandemic exceptionally well, because their surveillance and response systems have already been designed through necessity to be community-oriented, to be built on those principles. They haven't had any problem finding contact tracers or rebuilding a public health system. Test and trace is not a new phenomenon for them. Communities in Africa are well used to that, and in many developing countries. So I actually think Africa in particular, but developing countries, and Africa in particular, African countries, are actually showing us the way, in a way. This isn't about transferring from the north to the south the technologies of doing things through communities. It's about listening to the south, about the successes they're achieving with community-based approaches and investing in those approaches. So the technology transfer is south-north in that sense. And we could do with learning how developing countries have approached community empowerment, both in health, in emergency management, and in food security.
Indeed, I mean, what Veronica Korogo outlined there, the idea of all sectors being united, it's the opposite of the kind of what is now considered almost old-fashioned silo thinking that, you know, seems to be persistent in certain countries.
And everything integrates at the community. You see, the silos only happen because of the way we design the system. When you're down at community level, there are no silos. If you're in the local health centre, there's no silo. There's one doctor or a nurse, and there's one community. So I think that's the issue. The silos are the artifacts of external intervention. Now, you still need that external investment, but if you have a bottom-up approach to the way it's done, and you start with the community, then the silos disappear. Because the silos, if we all can work from different organizational points of view, but if we're investing in community-based approaches, the siloing becomes entirely diluted. So it's an artifact of the way we, very often in the north, see the problem and think that we have all of the solutions. And the same in health. My God, we have verticalized health to the point where we nearly have organization for this and the organization for that and the organization for the other. We should change all the UN names, you know. And so you know, in that sense, I mean, at one point I remember talking to the Minister of Health in Nigeria a number of years ago, and he said, "That's right." He says, "Your points are very well made, but do you know I have over 100 agencies with the health representation in my country from outside?" He said, "Who is he going to listen to?" And I think they're the issues, and I think it's a real opportunity for us to really recognise communities at the centre of development and at the centre of food security.
Thank you. I want to bring in Hasina Rahman now in Bangladesh. Hasina, could you just outline a bit about the reality of hunger in Bangladesh, and I suppose most immediately how that picture has changed since the outbreak of the pandemic?
Thank you. So Bangladesh has made huge progress on reducing hunger and poverty over the last few years by constantly improving in every segment of the Global Hunger Index. We see many gains across all the indicators, remarkable progress in stunting, but still we're ranking at 75 out of 107 countries. And with 170 million people, Bangladesh is one of the most densely populated countries around the world. The majority of the people here work in the informal sectors, earning daily wages like rickshaw pullers, labourers, factory workers who earn their living through jobs that require them to go to work. No work means no pay. Over 20.5% of the total population in Bangladesh were already below poverty line pre-COVID. We are now looking at possibly doubling of the country's poverty rate, pushing it to over 40%. According to some recent studies by UNDP, In Bangladesh alone, we're expecting 16 to 20 million additional people here at risk of falling into poverty in 2020. The level of people in poverty could go as high as 42 million. And there's been a triple blow in Bangladesh, like many other countries are facing, like with domestic slowdown due to the disease slowing efforts, sharp decline in exports, and also drop in remittances, which is the second largest driver of Bangladesh economy. It's been truly awful in this country this year. It's not just the pandemic that's killed over 5.6 thousand people so far, but this is just a small part of the story. In May, we faced the most intense cyclone in 2 decades. And then in June, we experienced severe floodings. The sad reality here is that those who are most vulnerable to the pandemic are the same people who are living on the front lines of climate change and natural disasters that hit Bangladesh one after another. And even more sadly, women, children, and people with disabilities are disproportionately being affected by this crisis. Between late March and early August, there were widespread unemployment on top of intermittent lockdown restrictions, with millions of locals stranded with little access to food and healthcare while exposed to COVID-19. Desperate local conditions have made public health measures like social distancing and increased hand washing extremely difficult. Many could not afford food, let alone soap, hand sanitizers, and masks. This is even more pronounced in the refugee camps in Cox's Bazar, where Bangladesh is hosting over 1.1 billion Rohingya refugees who are living in extremely overcrowded conditions in temporary shelters. Access to health, nutrition, and other facilities is even worse. It's nearly impossible for them to practice any social distancing, additional hand washing, and hygiene. And yes, we're hearing that the numbers of COVID cases in the camps is very low, but still we've had to reduce, the government has had to reduce the services in the camps to limit the spread of COVID. And this has hugely impacted the already basic support the refugees were accessing, pushing them into further insecurity. So there's been stagnation of jobs, people going back to the villages, overseas migrant workers coming back home, and it's putting a huge burden on the urban, the rural villages with all of this internal and external migration. We've been seeing disruption in the food chains due to the lockdown and transport challenges. Many farmers and workers in the agricultural sector, small and medium businesses, were not able to sell their products due to transport restrictions and market closures. Yet now so many people are struggling to make ends meet. Prior to COVID-19, the health system of Bangladesh was already really challenged. Quality of available, accessible, and affordable health services has always been a problem that we've been dealing with. Due to the pandemic, the healthcare system is facing even more strain. Routine health services such as primary essential healthcare and immunizations has been hugely disrupted. For many in Bangladesh, no income means no food. I would like to share a couple of quotes from some of the people who we have been directly interacting with during this period of the pandemic. We don't have any source of income right now. We are eating less. That's how we are coping with the lockdown. At present, there is no food in the house. So without caring for our lives, we are coping with the lockdown. There has been, by selling fruits outside, there has been combined efforts by the government of Bangladesh, development partners, aid agencies, local philanthropists, and different corporate entities for emergency food relief activities. The government has introduced lots of measures and stimulus packages and taken several positive steps to mobilize the economy. But it is pertinent to say that economic gains made over the last 20 years in Bangladesh are at risk of being lost. COVID has had a huge setback to the country's progress towards achieving food security and zero hunger.
Thank you, Hasina, for outlining a very, very stark picture there. And I just wonder, can you explain a little bit about the work of your team in terms of prioritising the stem of the erosion of development progress there and what you're doing?
Okay, thank you. So what we've been doing in Bangladesh is, so concerns programs in Bangladesh are all geared towards addressing hunger. We work in the areas of food security, health and nutrition, livelihoods, resilience, and humanitarian response. We work in the urban and rural areas and in Cox's Bazar, providing humanitarian assistance to people, the Rohingya refugees and the host community who are equally affected. From the beginning of the crisis, we have prioritized in supporting the people that we work with, in protecting the gains they have made through the work we have been doing together prior to the pandemic. We focused on immediate recovery support, risk communication, looking at hygiene promotion. We supported installation of hand washing stations in different rural areas where there's extreme poor people. We increased our community mobilization efforts to bring in community volunteers to support them in actually doing risk communications. We supported with food and non-food items for a number of vulnerable people and provided cash grants, which has indirectly benefited the local markets and the local producers also. Some of our work in concern has been around working with the health systems in Bangladesh. So what we did was we repurposed all of our health programs to support the most compelling needs within the health systems in Bangladesh. We aligned one of our programs with Bangladesh government's National Preparedness and Response Plan, with the ultimate objective to ensure better health outcomes for the disadvantaged. This includes people with disabilities. Another one of our health projects, we introduced micro health insurance, which alleviated the lost earnings and out-of-pocket expenses that extreme poor had been facing due to COVID. What we have experienced is that the urban poor have been more severely impacted by the COVID-19 crisis. This is particularly an area of concern because social protection programs in Bangladesh have mainly been focused on rural poor. In a baseline study we conducted under Concern's Urban Integrated Programme in 2019, the average monthly income of the respondents was around €55 per month. After participating in the project for a year, this almost doubled to around €100 and it improved by 81%. But during the lockdown, the figures are starking. It dropped to €9 per month. People exhausted their savings and started borrowing and selling assets to survive. We have been focused on supporting them to protect any gains they made, enabling them to adapt and build back better. In the rural areas, we've been working with the communities to build resilience to climate change within COVID-19. Our work has been around providing support on effective preparedness, response and recovery efforts, and strengthening the resilience to deal with floods and cyclones and river erosions. And in Cox's Bazar, we continue to provide our essential services to the Rohingya refugees in the areas of health, nutrition, and food distribution through our frontline staff and volunteers, while ensuring the safety of the Rohingya communities. We are implementing self-reliance programs for farmers. Both women and men are providing seeds and training on growing crops in sacks and rooftops. They're bartering the produce and using to diversify the diet in their households. We are also training Rohingya women to sew and produce reusable cloth masks. These masks are sold in camps, and the money allows the Rohingya women some freedom, but extra food and essential items. From our experience in our programs, the recent programs, we found that the lack of expectation of the assistance from the poorest is extremely low. Alongside their lack of representation, it's really striking. And sadly, they have an acceptance that they are being overlooked because they are poor.
So Hasina, I mean, I hope that you had heard the discussion already with Dr. Ryan and with Veronica Quiroga already, where the mention of the devolution of power to local areas and this idea of empowering people at local level is one of the key ways to protect against these issues. And I just wonder and presume it is the case that you feel that rings true.
Yeah, absolutely. We need to make development sustainable, and the only way that we can make it sustainable is actually empowering people at local level, bringing them into decision making, listening to them, hearing from them, providing them the support to deal with the shock so that they can get on with their lives. So bringing it down to the local level, but providing support, doing advocacy. We all need to do our bit to ensure that the people that are suffering the most, they get the support and the services they demand and they deserve.
Thank you. I'd like to bring in Dr. Sinead Walsh now. I just want to have a quick, brief final word with Dr. Mike Ryan, who I know it's 3 o'clock and he needs to disappear now. So if he's there, Dr. Ryan, a final word before we say goodbye to you, and then I suppose a concluding remark in terms of what you've heard so far.
No, I won't take any more time away, and I'd be very fearful of taking time away from Sinead Walsh, one of my heroes as well. And I was saying hello to Sinead as I leave, and I'm sure you'll continue with her. But no, it's been fascinating to listen to the other panel members, actually. And no, I leave the meeting with hope that we'll find these solutions, as it's a matter of will. Not much more, and I look forward to. I think we are moving towards recognizing that multiple sectors are needed all society is needed, and this must be driven through and with communities. And I think if we can take that view across many of these challenges we face, then I think we will make progress. And again, with thanks to the organisers, and thanks to yourself for organising this so well. I will leave you. I'm actually going to another very interesting engagement now with engineers from around the world who've been working on oxygen solutions for developing countries. So I'm about to go speak to the MacGyvers of oxygen delivery and see what they have managed to conjure up in terms of solutions for delivering medical oxygen in extreme environments. So you see, everyone's working. I mean, when years ago you think about medicine being doctors and nurses, and now medicine is about engineers and architects as well as it is about doctors and nurses. So I leave this meeting with great hope that we will find the solutions we need.
Well, thank you very much, and thank you so much for all your work as well. So thank you for your time, Dr. Mike Ryan there. And I will go to your hero, Dr. Sinead Walsh, and just bring you in there, Sinead, in terms of sharing the lessons that you learned from the Ebola epidemic, and I suppose that we can take in terms of what we're going through now with COVID.
Well, just as he walks out the door, let me just say, Mike, we're so proud of you here in Ireland, and I know you're doing formidable work, and keep going, and anything we can do to support. I can't help but start with that, and in fact, Mike and I first met in Sierra Leone, actually, when I was working on when we were both in fact working on Ebola. And I really just want to mention sort of 3 lessons today that I found particularly applicable to the COVID crisis from the Ebola crisis, because as you said earlier, Ella, I actually just came back from South Sudan, where I've been for the last couple of years, and so I'm now just starting a new role in Irish Aid, actually also setting up our new climate unit. So we might come back to that if we have time later on in terms of integrated approaches. But just to mention those 3 lessons, I think the first and very much the very first lesson that came out of the book that I co-wrote on Ebola that you mentioned was this point about community engagement and community ownership. What we started to do in Sierra Leone, and we unfortunately did for far too long, was kind of one-way instructions on what to do, what communities should do, and also quite a militarized approach, unfortunately, to sort of quarantines and so on. And so when I was in South Sudan, and I had the sort of unusual opportunity where you can actually try to apply some of the lessons that you just spent a lot of time reflecting on. We tried very hard, given that South Sudan has a sort of a militarized government. We tried very hard to, from the beginning, try to keep the military side out of the equation and have it be more sort of health focused, but also, kind of most importantly overall, as colleagues have said, really try to support communities to implement their own COVID prevention strategies, because that was when we eventually did that in Sierra Leone on Ebola, it was so much more effective. And coming back to some of what Hasina said, I think sometimes we can underestimate how much the basics can be missing for people. So, it's all very well to say hand washing, in Ireland or in Belgium, but you say hand washing in South Sudan and people go, well, where's the water? Where's the soap? So I think giving people the tools, but very much helping them, supporting them to implement their strategies, I think was the first maybe key lesson I'd highlight. The second kind of comes back to the point about sort of context being everything. And it's an issue about, I suppose, an issue that took over our lives as responders in Sierra Leone was politicization and corruption. And one of the reasons we wrote so much about this in the book was that most people don't talk about this. We tend to focus on more technical issues, what went wrong, well, this technical issue or a shortage of funding and so on. But we all know how much, and crises are particularly vulnerable in all of our countries to politicization, often to, you know, people abusing the crisis for their own ends. And so I you know, there wasn't so much a solution to that that I could try to bring to South Sudan, because it's a sort of an everyday kind of a battle. But what I did was I set up an informal coordination group of kind of WFP, ICRC, MSF, ECHO. And what we tried to do throughout the COVID response was, you know, strategize and be very responsive and flexible to all the different, you know, ways in which politics was manifesting itself. So, for example, you know, sometimes there were movement restrictions on humanitarians, and COVID was the reason, but, you know, maybe they weren't so justified. Sometimes, you know, and we saw this also in Sierra Leone, a minister would be hired or fired, or, you know, in Sierra Leone, we had, you know, people being asked for bribes. If an NGO wanted to set up a treatment center, there might be a bribe requested, and so on. So it's just about, I suppose, acknowledging that. Let's be frank about that, and then let's try to retain, and also a tip for donors very much, you know, let's try to retain the flexibility and responsiveness to try to work through those issues rather than just pretending they don't exist. And then the final lesson, and I think it very much comes to our theme today around hunger. We actually lost more lives in the Ebola crisis from non-Ebola related issues. So it was because of Ebola, because people couldn't get treatment for, you know, HIV or malaria or typhoid or whatever the case may be. So those deaths and also from food insecurity actually outnumbered the deaths from Ebola. And so in a country like South Sudan, if you know, the global hunger index that we're launching today tells us that 6.48 million people are in acute food insecurity in South Sudan. That's a little bit over half of the population. So you're starting a response to COVID. At the beginning, we had 2 ventilators, but we had 6.48 million people who needed food support. So we had to make very difficult, but I think necessary kind of calculations about where to put our energies. And we tried, especially when we saw that death rates from COVID were not as high as we had feared, with an incredibly young population, we tried then to focus very much on the secondary crisis, which was something we neglected during Ebola. So I think those are sort of, you know, maybe 3 of the most salient lessons that I think, you know, we tried to work on. I think we need to continue to work on in the COVID response.
Sinead, I don't know whether you heard Hasina Rahman's contribution there about Bangladesh, but can you outline some of the policy considerations for donors now, particularly in relation to those countries that are struggling with the heaviest burdens of hunger, particularly in light of COVID?
Yeah, I've been scribbling furiously during Hasina and you know, Veronica. In fact, all of the presentations. I mean, I think you know, Mike kind of touched on it. If you tell, you know, this sort of silos issue, it is, you know, as we say, a first world problem. I mean, if you're in South Sudan and, you know, you tell a cattle keeper, you know, whose group is involved in a conflict with another group, you know, over water, if you say, well, you know, I think this is related to climate, and, you know, and so on, they would be like, yeah, thanks for the tip. You know, I mean, these are really issues that are just so obvious when, you know, to those people, you know, that are actually, you know, that we are aiming to serve. And so I think what everybody has said today, and to me, it seems like the most important kind of theme, well, community-based approach is also incredibly important, but this notion of the integrated approaches. And I think the summit, you know, that's coming up and that Minister Brophy talked about earlier, is super important. One thing I think Minister Brophy didn't mention, but is maybe interesting to colleagues, is that we're actually focusing a lot before the summit on trying to support these country level dialogues, you know, in the least developed countries, so that we can get those voices up to the summit. And actually that's kind of something that we try to do. We big focus of our kind of climate work as well. And so, you know, the need for the integrated approaches, I think, is absolutely, you know, we just have to keep hammering on. I think, for practitioners, it often becomes obvious, but you know, we have a lot of people, you know, in working in donor agencies in northern countries where it may not be so obvious. So we just have to keep going along. Maybe one more point to mention also for donors might be, you know, I suppose we have an expression in Ireland, maybe in other people's countries as well, you know, never waste a good crisis. So, you know, how can we try to use COVID to do some of the things that we were previously told were not possible? Because you're often told, oh, that's not possible, that's not possible. Actually, it's amazing what becomes possible.
Indeed, yes.
And let's try to use that and look at the transformation that we want to see. And yes, we have to respond to today's crisis, but can we do that in a way that is laying foundations for more transformative approaches? And I think that's something that, you know, donors need to be looking out for and trying to support. So maybe a couple of initial ideas.
Thank you. I mean, Professor Robin Alders, if I bring you in there, it's an important point, isn't it, to remember so far in this pandemic, it is amazing, as Sinead says, what is possible. Has Robin gone? Professor Alders, is she there? She's gone. Veronica, she's there. So can you unmute yourself? No, sorry, I'm terribly sorry. We're still not hearing you. Just check there. Sorry, this is on your mute button, just to make sure it's unmuted.
Okay, how's that?
Thank you. Perfect.
Excellent.
Yes.
Sorry about that.
Sorry.
It is now 1 a.m., 1:15 here in Eastern Australia, so sorry about that. But this is a crisis not to waste. We really do have to work together. I want to thank the Irish government for providing funding to get those voices, because the people who have to be involved with this change, they are the ones that understand what is possible, what's feasible, what is needed, and what we've all been missing. So thanks to the Irish government for that support. Hopefully many other nations will come in to support that, but also family farmers in each of our countries, and those, we all know that hunger is everywhere. And I think for high income countries, being honest that we don't have the solutions, we ourselves need to make changes, and that need for us to learn together is going to be very important, and getting the policy environment that stops sectors competing, that stops UN agencies competing, that stops in our resource scarce environment, that we have a framework that gets people wanting to work together, not to pull resources for their own area. But it's exciting. We do see that we do have an opportunity for positive change.
And this policy response is, as you mentioned, the focus, the important word there is integrated, I presume.
Absolutely. And we use the term One Health in that holistic approach. I mean, in the early 2000s, I went to a wonderful conference in Galway that was what introduced me to One Health. It was very holistic. It didn't just have a focus on infectious disease. When we see emerging infectious disease, that tells you the system is out of whack. Something else is going on. And that One Health, the health of our planet, the health of our society, and of people, animals, and plants, if we can get that lined up, things are going to be looking much better.
Thank you. And Veronica Karogo, Deputy Director of Nutrition and Dietetic Services in the Kenya Ministry of Health. Can I just bring you back in there? You know, you outlined some of the successes, the very impressive successes that you have had in the last 20 years tackling hunger. I just wonder, in the context of COVID, in the next year, how do you plan to protect that progress in light of the economic challenges and the clear health challenges because of the pandemic?
Thank you very much, Ella. Of course, the COVID pandemic has brought in issues of unemployment because people have lost jobs. So we are likely to see more people getting food insecure. And of course, it may erode the gains that we have done. But what government with partners have done is we are promoting a number of initiatives that can be able to sort of cushion the most vulnerable. For instance, like the cash transfer, the social safety net, where families who are sort of vulnerable are given some cash, in monthly cash stipend for them to be able to be cushioned against the basic needs of the lost income. But one thing in the next 6 months, we are working also with social protection in a new project where the resource poor households with the under 2 years old children or pregnant and lactating women are given some top up in terms of money, but this money goes specifically for nutritious food. So we sort of integrate that with a nutrition education. We did a pilot, and we saw that at least we were able to cushion many children from getting malnourished. And we are rolling this one out in about 5 counties. And we are hoping that we'll be able to sort of sustain also the gains in those counties. But more importantly, there's another initiative that we are also promoting called Baby Friendly Community Initiative. And this brings together health, social protection, agriculture, and the communities, empowering the families to take charge of the feeding practices of their young children, empowering the mother to breastfeed months and be able to introduce appropriate complementary food after 6 months. We have seen with this integrated way of tackling child feeding practices, we will be able to not only to empower the community, but also to sustain the gain, because in addition to the nutrition education, the families are being also taught on issues of home gardening in order to produce food for their family. But also more importantly, during the COVID pandemic, of course, there was fear of mothers taking their children to the hospital for growth monitoring. And we found this is a big gap. And this is an initiative which we have been able to promote with the Concerned Worldwide UNICEF called the Family Middle Upper Arm Circumference. And this is a tape we are empowering mothers to be able to monitor the growth of their children at the household level. And if the child is malnourished, we have the self-referral to the hospital. So the mother doesn't need to wait for the community health volunteer to come and monitor the growth of the child, but the family is empowered. A very simple tip, but empowering community to be in charge of the growth of their children. And we are rolling out this in order to be able to address acute malnutrition, early diagnose it before it gets worse. Thank you.
And Hasina Rahman there, I can see you nodding. And there's an awful lot of very simple but extremely effective ideas there. Clearly also this idea of empowering women being at the heart of a lot of them.
Yeah, absolutely. Concerns projects, the core of concerns projects actually work on empowering women and youth. So when we are going out in any of our interventions, we really look at where we can bring in the women, adolescents, elderly women, and take them into the decision making. And then there's another approach that we use is engaging men and boys. So we try to stimulate the male figures in the family to understand from the female's point of view what is required to bring more income and happiness to the security into the family. So absolutely, empowerment, I mean, it goes a long way.
And I know, I hope I'm correct here, Hasina, but my own reading was that Bangladesh has made significant inroads in curbing child stunting. Mm-hmm. And I wonder, again, that question of protecting the kind of progress that has happened in light of COVID and the importance of that, and are there mechanisms by which that's happening?
Well, there are mechanisms happening in country. That Bangladesh government, as I mentioned, that has put in different initiatives and subsidizing on agriculture and then looking at how to stimulate the economy. But at the core, what needs to happen is investing in resilience. because that will provide triple dividend. So looking at how to reduce the disaster losses, unlock the development potentials, and foster wider social and environmental benefits. That's what we can get. And something that we also need to look at is exceptional collective commitment from the government to consider for the most vulnerable people. We need to promote sustainable livelihoods as a part of the economic recovery. Multi-sectoral interventions are required to address the multi-dimensional causes and impact of food insecurity, hunger, and poverty. There is a compelling need for the government to provide support with a reliable social protection system, which has also been mentioned. And this will prevent households from resorting to negative coping strategies and risking the food security and the access to basic services such as health, nutrition, and education as soon as the incomes are affected. So the strong social safety net that really needs to come into play now in the times of COVID to bring a more sustainable solution to this particular crisis and the future crisis that we might face.
Thank you. And I'm mindful of the time, and I want to hand over in a minute to Germany, to Bettina Ezeli, the Programme Director from Welthungerhilfe. But before I do that, Dr. Sinead Walsh, I just want to finally ask you a little bit about this climate unit that you're involved in. And obviously, you know, it goes without saying that in all of this, climate change hangs over.
No, absolutely. And I think one quite compelling statistic in today's report is actually that, let's say, roughly 30% of global greenhouse gas emissions are coming from our food systems. And then, as we know very well, especially in countries like Kenya and Bangladesh, then climate change is subsequently, you know, really making a lot of people even hungrier. So, you know, those vicious cycles, I think, are so critical. So it's great. We have established a climate unit. It was actually one of the commitments within our program for government. So it's really got, you know, this agenda really has support from the top. And coming back to a point that Robin made, you know, we're also doing a lot at the moment domestically on climate action. And, you know, as Robin said, I mean, it's just so critical, you know, to have the credibility to really advocate on the international stage. You know, we really need to be, you know, doing our very best at home and improving all the time. So I think we're in a good space, and, you know, definitely, you know, looking forward to kind of working with colleagues. I think in the Sustainable Food Systems, you know, work and summit and all of that, you know, I think it goes without saying climate is going to be absolutely central. So we're really, you know, hoping we'll be able to strengthen our work a lot on that.
Thank you so much. Well, I'm very, very grateful to all of you. And I'm also mindful, as Robin reminded me, that we're all at different time zones. It's easy here in Dublin. It's in the afternoon and I feel fully awake. But obviously over there in Australia, Robin, it's very late. So we're very, very grateful to all of you. Professor Robin Alders, Veronica Quiroga, Hasina Rahman and Dr. Sinead Walsh for that really, really interesting discussion, which, as we said earlier, will be on the Concern YouTube page as well. And also obviously to Dr. Mike Ryan, who's left us now, but a very important contribution. So now I'm very pleased to hand over to Germany, to Bettina Ezeli, Programme Director from Welthungerhilfe, and she's going to have the final word.
Thanks, Ella. I'm really honored to close this event on behalf of Welthungerhilfe and Concern. Today we have discussed multiple challenges that we are currently facing and an immense mountain we have to climb to reach zero hunger in a decade. But the Global Hunger Index has also shown some encouraging trends. Despite all the challenges, many countries have made substantial progress in the past 20 years. This shows that it's possible to reduce hunger. Also, our panelists have showed with various and ample examples levers for change, and one of them and all of them including that we need to work together with communities, that we need to empower women, and that we need to look at integrated approaches. Indeed, also, through our daily decisions on what we buy and consume, every single one of us can support inclusive and sustainable food systems, wherever we live, and we can start now. But the key element, and this came out very clearly as well, is bold political will and action. Investments are needed, but can only be reached to their full potential if supported by an enabling political environment. In the coming months, there is ample opportunity to do so, and two of them have already been mentioned, the UN Food Systems Summit and also the Nutrition for Growth Summit. We've all come together here today with the common goal to end the daily scourge of hunger, the greatest moral and ethical failure of our generation. And we are here to gather political support for these efforts. I would like to thank everyone who has joined us on this journey today. Dr. Mike Ryan, who has delivered a very personal and inspiring speech keynotes today and has kicked off a vivid discussion. I also wholeheartedly thank our panelists, Dr. Jeanette Walsh, Veronica Quirogo, Hasina Rahman, and a particular thanks goes to Dr. Robin Alders, not only because she is speaking here at night, but because she's contributed to this year's GHI. I would also like to take the opportunity to thank Concern Worldwide for the ongoing cooperation on the Global Hunger Index, but also in many areas of our work as part of our shared mission to eradicate hunger. A big thanks goes also to Ella McSweeney, who has brilliantly guided us through today's events, and often forgotten, the technical preparation team in the background and those who have made it all possible. Last but not least at all, I would like to extend my warmest thanks to everyone who took the time to join us today from all over the world. Thank you.